July 1 is not very far away, and AHPRA, which is the Australian Health Practitioners Regulatory Authority, have come up with guidelines that define how a regulated health service like cosmetic surgery or cosmetic procedures should be performed in the context of a clinical setting. So there's a whole heap of rules that govern cosmetic surgery, starting from the care given to the patient by the practitioner, and also very stringent do's and don'ts about advertising. The same things apply to cosmetic procedures that are non-surgical procedures, but of a lesser intensity, but nevertheless still there. Now, this is all designed to make the industry be better regulated so that the consumer can make a choice with confidence that the person is going to give the consumer the best possible outcome. And these are, again, talking back into systems and safeguards. These are regulatory safeguards built around the delivery of cosmetic surgical care and cosmetic procedural care to patients, where you cannot mislead based on advertising, because we all know that advertising plays a big role in anything that we buy and sell nowadays, and cosmetic surgery and cosmetic
we're,
procedures.
as media, we're heavily regulated too. I mean, there are so many things that we can and can't say, and we can and can't endorse, and we have to be, thank God, completely transparent now when we've been on the receiving end of a gift or a free treatment, or we've been paid to be a spokesperson for a treatment, a procedure, a product. And I think that has been a massive benefit to the end reader, the consumer, the listener. But this is going one step further, because it's now placing that same responsibility on the practitioners.
That's correct. So what's happening is there are guidelines at every aspect of a patient journey, starting from how they interact with your advertising, how they, what can you say, what can't you say, what words you can use. And it's all about trying to remain as scientific as possible and as evidence-based as possible. To give an example, colloquial terms cannot be used in isolation. They have to be used as medical terms. For example, you can no longer say the word tummy tuck, if I can use that term. You have to combine that with the word abdominoplasty, which is the medical term for the procedure, basically trying to showcase that this is serious surgery.
But let's talk first about the surgical procedures, because you are a plastic surgeon, and I would like to know how this might work as part of a consultation, and or rather how you will be offering it in your practice.
Look, I think that I do offer it in the practice currently. So I have been doing that for the last 5.5 years. And the current guidelines specify that you have to administer the psychological testing at the consultation. And based on that, whether it goes for additional screening or no additional screening will be determined by the test. Now, I think how we're going to do that is to inform the patient that as of 1st of July, you're going to have a mandatory testing to look for anything that is hidden, covert, that you're not obviously figured out. And if the test turns out to be positive, indicating that you need to have additional treatment or non-surgical assessment and so on and so forth, then that will be clearly conveyed to the patient before they take the test, because that's kind of very, very important, in my opinion, to tell the patient the implications of turning positive or turning negative, right? And they come with an expectation, I'm going to have a surgical procedure, and then suddenly you're telling them to go and have a mental health assessment. That's not a very aligned discussion. So it's something that they'll be told. Like, the mandatory requirements as of 1st of July are a GP referral to see a surgeon for cosmetic surgery, and a in-house psychological testing. If the result turned out to be positive and you're seen as someone who may not be suitable, you need to have additional testing and counseling by a qualified psychologist to see how best we can optimize your care for you.
And I find that, I guess that's reassuring. And in total transparency, I had my first cosmetic surgery when I was 17. I was 17 years old. I wanted rhinoplasty. I booked in. I didn't need a GP referral. I went to a plastic surgeon in Canberra at John James Hospital when I was 17 years old, and I had my first rhinoplasty. It was not for a medical reason. My second rhinoplasty was for a medical reason because I had my first one too early. And my, skull hadn't grown, and I needed to have my septum straightened out when I was 25. But so I guess I'm reflecting on personal experience, and also as a mother of a 12-year-old who may not be getting marketed to by advertising to be interested in cosmetic surgery, but she's certainly getting marketed to, because when you see, pop stars and actors and actresses who have undergone almost like a complete makeover, for lack of a better word, exactly. When you see some of the most famous, well-paid models in the world who literally were not born this way and achieved their look through surgery, it's hard as a mother to then say, look, oh, you can't do that. Don't do it. It's terrible for you. So as a mother, I'm excited that the medical fraternity are going to close ranks, and they're going to say, the GP is going to say, no, I'm not going to give that referral. The surgeon is going to say, let's have a look at the psychological framework before I proceed with this procedure, and potentially won't proceed with the procedure.
Yeah. I agree with you. I think social media, as we all know, is a part of our life, and I think with regards to body enhancements, cosmetic surgery, cosmetic non-surgical procedures, it's quite rampant, and little by little, and if we can use the word creep, the advertising influence just creeps on you. So what was normal a year ago has been incrementally increased. So the new normal is slightly different. Yes, it is aspirational because that's how it's been marketed to you. And all of a sudden, what you thought normal at the age of 11 is not normal at the age of 13, and so on and so forth. So all of a sudden, the ground realities are shifting very, very fast. And people, if you follow Instagram, you'll know that people post their own experiences or photographs of having had surgery before and after, which is very knowledgeable. But at the same time, how does a 12-year-old interpret that one?
Well, I also like it from a consumer benefit point of view, in that, if I come to your clinic, I'm being treated as a whole, and not as I'll just polish up this, but we'll ignore this cause area.
Yeah.
And for me, one of the key things in my kind of regenerative journey was the hormonal piece and the integrative and regenerative medicine conversation. So my aesthetics physician, Dr. Joseph Hakeek, he said to me, before I keep buffing and puffing and filling and lasering, which we've been doing, you are now at a stage where you need hormonal intervention, and I don't do that. So I'm going to refer you to a doctor who is actually going to attend to that, because the sagging that you're now experiencing is no longer just normal age. It's led by hormonal changes. And my work will only be a patch job if we don't attend to the root cause. So off I went to see Dr. Nasser for my hormonal needs, and that was revolutionary for me. It was just a great aha moment. And then similarly for device-based or threads, that wasn't his specialty. So he referred me to another doctor within his practice who administered the energy devices or the threads, which I've had with Dr. Adina within his practice. So I do love that. I do love that I was cared for so much that, I was moved around, and it was through that network that I got the referral for my surgeon who performed the abdominoplasty, and my surgeon knew the other doctors that were in my networks. And so I felt safe. But I thought to myself at the time, wouldn't it be great if everyone was together? I didn't have to go to 5 different clinics to do this.
So you're right. I think expertise sometimes is it's hard to maintain that level of expertise in one place for obvious reasons. But I think shared care is probably in a way a very good model of care, and we're beginning to see this coming through fast and furious, as we say. And I think the future is also going to be very groundbreaking as we see more technology, more research coming into what we call as cellular aging and metabolic health. So you spoke about hormonal health. Hormonal health is one way of influencing your overall metabolic health, but people talk about lifestyle medicine and how lifestyle impacts your overall health. And that's a broad discipline called metabolic health. And there's plenty of evidence to say that how you look after your metabolic health, starting from your gut health and your overall sleep health and your mental health. So everything impacts one another. And I happened to read an article recently that suggested that your muscle is not just a structural organ for strength and mobility. It is an endocrine organ, and every time you activate
your muscle is an endocrine organ. Wow.
Correct.
I've never
and
heard
that's right. It's a new paper that I read published last year, and it said that every time you activate your muscle, you produce a whole heap of beneficial hormones and growth factors that are very essential, that tick off A, B, C, and D. Right? And similar way, your sleep also impacts the way your gut health impacts the next day morning. So it's very, all of these, as we have said before, have developed in independent silos. But I think in the next 5 to 10 years' time, there will be a merging of all these, and all of a sudden, you're now going to see somebody who's going to be practicing quote unquote integrative medicine, where you may go in to see somebody for let's say a cosmetic concern, and the person might say, look, have you thought about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and taking you back to a cellular level of aging. And mitochondrial aging is a big thing now, and people are understanding how mitochondria ages influences your entire aging, how your gut health influences your skin. So these are all things that are just around the corner and just waiting to be integrated. So I think there's plenty of research. It's only a matter of time before they become the new norm.